Well, hi, welcome to today's webinar, Optimizing Healthcare Event Experiences with Smarter Registration. I'm Julia Riley. I will be your host today, and I am thrilled to introduce our wonderful speakers. Joining me today are Noel Bashir, SN Healthcare, Nicole Braley with Blaze Ahead, and Susan Lopez with St. Luke's University Health Network. So ladies, welcome to each of you. Thank you so much for joining us today for this fun discussion. And I'd like to begin by just having each of you share a little bit about yourself, and then we will get right into talking about how we can improve registration for your event. So let's go ahead and start with you, Kanwal.
Sure. Hi, everyone. Thank you for joining today's webinar, and thank you for having me, actually. I am Kawal Bashir, Vice President of IT Applications at SN Healthcare. I'm excited to be here with you all. With over 16 years of experience in healthcare IT application development, program management, and process improvement, my goal is to have a better outcome utilizing innovative tools and initiatives that improve the technology, improve human health at the end, and obviously the improved ROI for the company as well. So this is a little bit about me, and I'm really excited to be part of the webinar today.
Wonderful. Nicole?
Yeah, sure. Thanks for having me. My name is Nicole Braley. I'm a Chief Marketing Officer. I'm also founder of Blaze Ahead, where I have the opportunity to work with organizations that need a Chief Marketing Officer, but not yet full-time. And so I love the opportunity to come in and help shape marketing and sales and strategy functions across healthcare, where I have a pretty strong focus against commercial goals, and campaigns and events are always a big part of that. I have a really big passion for women's health. And so I love when I have the opportunity to work within women's health organizations as well. But yeah, I love doing this kind of stuff and sharing and learning from other folks as well. So thanks for having me. I look forward to the conversation we're going to have.
Wonderful. Thank you. Susan?
Yep, my name is Susan Lopez, and I'm Director of Corporate Giving and Special Events for St. Luke's University Health Network. And my role is really to partner with companies and vendors that we utilize to really match what their philanthropic goals are with what we have going on at St. Luke's. And a lot of times that does include events, sometimes larger scale, sometimes more salon type dinners, and working very closely with our donors. So the event management side of utilizing Eventcombo is really important to us to make sure that we have streamline registration, that we're able to obtain all the information we need from our guests, and that they have a good end user experience as well.
Excellent. All right, let's go ahead and dive right into our registration roadblocks that you might experience. What slows down healthcare event registration for you and leads drop-offs? Nicole, would you like to share?
Well, I think if I look at from a kind of 50,000 foot marketing, kind of one-on-one, it's right message, right time. And making sure that we're understanding sort of what's in it for the customer, right? I think the way that we position it, the way we market it is going to kind of be the opportunity for us to even measure like what the interest is and what's really kind of nailing in terms of what's resonating and getting people to register. So I think there's a lovely opportunity to do a lot of A/B testing and then using data, right, to optimize registration from the marketing and messaging and timing standpoint. But I think overall, right, timing is everything. If you're doing an event for providers, which are very busy folks with oftentimes a clinic schedule that's quite full, and thinking about, well, gosh, I'm going to host an event, even in 4 weeks, their schedule may already be full, right? And so really giving enough lead time to be able to have folks carve out time to be able to attend. Last minute things are probably not going to work, or thinking about things during off hours or even weekends, right? So I think it's all about the marketing and the positioning, doing some A/B testing to aid in registration to see what's resonating, and then secondly, giving as much leeway as you can in terms of registration time.
That's an excellent point. You kind of led right into my next question, was how expectations differ between physicians, researchers, sponsors, and attendees. So that last minute registration is a good point there. Susan, would you like to jump in with that?
Yeah, I think depending on each demographic, right, they all are going to expect different things. But I think one thing that they all have in common is that, especially being in the healthcare field, when our jobs are all wrapped around innovation and technology and all of that, no one wants to go into a registration system that's clunky and ask repetitive questions, and it's just the most unuseful system ever when it comes to a person going in and registering for an event. So we want to get the most important key information that we need from our end to be able to manage the event effectively. And we want it to be a quick and speedy process for the person entering the information. I think across the board, whether it's a doctor or a donor, we all want to make sure that everyone is having a good experience from the second they register, because that is kind of setting up what the picture and what the event's going to look like going forward, if that's their first impression, right? So I think it's also really important for, especially if they're working on CME credits and things like that people have all of the pertinent information up front about the different courses and all of that, and have access to that information readily so they can decide, whether the event makes sense for them or not. And so that they feel prepared when they're attending these events as well, because they're taking time out of their day. Yes, it's required of them to do that, but we want to make sure they feel good, when upon arrival at the events. So
great. I just want to point out we do have some Q&A coming up. So if you have any questions that come up, go ahead and put those into the chat box, and we will get to those in just a minute. Susan, you pointed out CME events, and I wanted to ask about that as well. What are the key inefficiencies that you see across the different types of events, CME events, medical conferences, healthcare tech summits? If you'd like to talk a little bit about that as well.
Some of the inefficiencies, some of that comes from the event management side of things on the back end, I think. It's just in who is managing those events. Sometimes those events are hosted by people who are not actual event planners and things like that. So I think sometimes on the logistic end of things, there can be things that are maybe not completed, to industry, like best practice, I would say. Thinking of it from on my end, from the development perspective or advancement perspective of raising money for an institution like a healthcare company like St. Luke's, it's important to be able to capture information as far as demographics to, even emails, addresses, all of that, making sure we have all of that information and that information gets put back into our system. A lot of times people aren't even thinking the value in that data and how that can be used for future fundraising purposes. So I think the inefficiencies lie in people just not really realizing how to utilize that data at the end of the event. So I think that is one of the biggest areas that I'm trying to focus on in my position.
Your expertise is shining through, ladies. We can definitely see that you are talking to these points well. Nicole, again, back with the marketing side of things, what do you see in the key inefficiencies across those different types of conferences?
Yeah, so events, I always, will tell my teams, and, within the event should never be a standalone thing, right? It should always be connected to a larger campaign and a larger opportunity. So to Susan's perspective, right, you host an event and you are, real campaign objective of the event is to, get net new leads or to get so many opportunities, et cetera. If those KPIs are outlined at the onset of sort of the planning of the event, and you have different stakeholders engaged and everyone knows, like, okay, we're here to get 350 net new contacts, and we're here to get, 16 net new opportunities and whatever. That sort of kind of initial sort of put some things down on paper so that everyone's connected during and post event. So it's not just the person managing the event that's doing all of the work, right? And everyone has a vested interest in understanding why we're actually doing this and how it kind of hinges to a greater campaign. So I think that's usually the one thing I always, really stress to folks is a campaign or an event is not a standalone thing you're doing, right? It is part of your branding. It is part of a campaign that should have metrics and commercial value. And how do we realize that? Well, we realize that by the output that we get from the event that she was just referring to. So I think that's like a very big disconnect, but that's not rocket science. That's very easy. It just takes process and people, which sometimes can be very difficult, I understand, but the technology should be the enabler there, right?
Yes, perfect segue actually, because that's what we need to talk about is the event tech and the smart strategies. So Kunwal, tell me what is working in 2025?
AI, I would say. I mean, the healthcare registration should be seamless, faster, and secure. So we wanted IT or tech companies should make sure that these are covered and bubbled up, right? Complex, lengthier form, collecting excessive information can cause the drop-off or reduce in registration. Manual verification process, that needs to be eliminated. And those can be eliminated by using AI and automating some of the verification processes. User experience, I know Susan had mentioned a few times, and that is the tech side of it. how can you make a user experience better? Mobile use experience. When you are using the application from mobile, it should be user friendly. It should be accessible. It should have auto save or collection of the data automated. Some of the integration, I would say, for 2025, have these event applications and tools integrated with the systems that we are using. So from technology and healthcare side of it, I would say any attendees, I have seen people using papers to spreadsheet to SharePoint to integration between SharePoint to their platforms, collecting the forms, collecting the data, fetching it out, and then outreaching the patient. By that time, you lost the patient. So integration between the platform of getting the attendees, getting the patient's name or the attendee's name, and integrating it into tools where you can start sending out emails, start sending out promotion, start sending out what's due for it. From patient and healthcare perspective, if this is a healthcare event where you are trying to raise your revenue or volume or retain the patients, you have to have these tools integrated with EHR system. So you have seamless registration, not only for the event, but also for their chart creation in EHR. And that goes into the analytics, predictable data, so how many attendees had come in for diabetes or what patient is due for. Those type of campaigns can be generated through these type of events, and we need to have these events applications you start utilizing AI. So you're not focusing on registration piece of it, you're automating a lot of platform to make sure that you are focusing on a lot more other stuff. I believe in white glove service. So reaching out to the patient yourself, just confirming, hey, we'd send you automation, but you have not come for your appointment. Closing the loop. The main goal is to improve human health. So, using technology the right way, integrating them the right way, and using automation, what I think will save us in 2025.
Great. Yeah. And definitely is improving with the administration workload as well, right? When you're taking some of the automation into effect there. Very good. So how is smart registration solutions reducing that administrative workload, enhancing attendee experience, and even boosting event ROI? Who would like to take that one?
Yeah, one thing I'd like to just piggyback that will answer sort of that, and Susan will have probably much more to add, is one, if you are, marketing to patients, make sure your marketing team is ensuring that all of those patients are opted in for marketing communications if it's things outside of their treatment plan, right? If you want to invite them to other marketing activities and events. The second thing that I, think is a good trick of trade, right? Thinking about timing, thinking about Camel's thing of like, gosh, don't tease them with an event and then follow up like 5 weeks later. They've already forgotten, right? So one of the great things you could do as you start to kind of tease the event is actually get people to register their interest. Just get their name and email and say that I'm interested, and then you can reach out to them later. But that way you can kind of capture and start to promote your event without having the full-blown registration process open, even if your agenda is not completely done. But you can start marketing it way ahead of time, but just allowing people to say, yes, I'm interested. So that's a good way to capture net new leads and interest to your event before you're probably ready to hit the big red go button, right? And before you're ready to go. But anyway, I'll turn over to Susan, who probably has a lot of things on the efficiency side as well.
So I would just say something that we have done with Eventcombo is really create a comprehensive website and web presence for a very large event, charity ball, that we are hosting in May. So the comprehensive website really addresses, the basic questions about date, time, location, all of that. It goes into frequently asked questions, provides advertising, well, not advertising space, but, recognition for our sponsors for that event. You can purchase tickets from that space. So really creating a comprehensive web presence. So as many questions that can be answered as possible by someone just visiting the website is going to be paramount for the end user experience, and also takes off the workload of us getting a million calls to our office as well. Something that we're going to be utilizing too is with, the email communication standpoint of utilizing Eventcombo. So being able to upload a list of these are the folks that we'd like to invite, and the system being smart enough to recognize whether or not someone has registered. And then for those that haven't, setting up preloaded reminder emails for people to RSVP. Again, we're uploading that email communication, but it's kind of like set it and forget it. And the system is going to, continue to automatically reach out to those folks to get them to RSVP, which really helps to create an an efficient process when it comes to marketing to your donors or your intended audience. So that has really saved a lot of time on our end from our team's perspective. And then as far as, when the day of the event comes, creating just a seamless registration, so on arrival registration, when they get there, we can easily print out their name tag or their name badges, being able to know who has checked in and who hasn't from our gift officer standpoint, so we can really manage and work the room, because a lot of these events are going to have hundreds of people, right? So it's not like you just easily scan the room and say, oh yeah, he's over there in the corner or whatever. It's being able to realize in real time who is in attendance and who has not yet arrived. So there's a lot of different aspects of Eventcombo that are really going to help make our pre-management of the event easier and more efficient, and then also for day of activities. And there's also a lot of, additional efficiencies on the back end then after the post event as well.
Excellent. Thank you. I'd like to talk a little bit about how role-based registration, automation, and integrated platforms are improving. Kenwell, what do you see?
Certainly. So the improvement in role-based automation, that is physician related. Physicians should see the screens that they need to see, should be faster. It should be a little bit more automated. So their CME credit and accreditations are not manually counted, and the tailored to experience physician research, right? Researchers and other attendees. I would say the seamless integration with I'm hearing, Susan, a lot about Eventcombo, and I'm really interested to know a little bit more about it, the experience of Eventcombo and how it would improve that. But I guess we'll chat again on that perspective. But yeah, certainly role-based has to be automated, right? Improve efficiency. We talked about administrative hours, how much manual work it is to get the attendees, upload the attendees, do all that stuff. It needs to be automated. NFC badges, right? Facial recognition, automation of the FNQ, even the questionnaires that in a chat box should be collected and distributed to the attendees that are asking these questions. And some of these, I think the AI generated tools that can improve that process for role-based registration will eliminate a lot of manual entry. So preloading of the data and attendees and tracking of their roles, and then tracking of their CME credits and all the other good stuff.
Right. Well, you got some engagement here in the chat about that. So Celine's already saying she would love to see how AI can help to create a better experience for attendees and for the admins. That's true. It's kind of a cool experience there. And then she does have a question. The registration process is often the first experience that attendees have with an event. So what are some innovative ways to ensure it's secure, especially in healthcare settings?
So I will say St. Luke's is a healthcare network that our IT security is paramount in everything they do. So for anyone to even get approval to be a vendor of ours, it usually takes months and months and months for different approval processes. And, I just have to submit it and they do the work. So I don't know exactly what they're checking off, but there's a lot of different security clearances and things like that the vendors that we utilize must have. And we use Blackbaud as our CRM system to manage all of the information about our donors. And so that is a company that has very strict, IT security restrictions and clearances and things like that. However, St. Luke's actually required even more of them in order to become a vendor of ours. So as I mentioned, we do utilize Eventcombo, and they've had to have similar clearances as well for us to be able to work with them. And what we are currently working on is an integration with Eventcombo into our CRM system so that the two systems talk. So for us, IT security is paramount. And I think that has to live within the foundation of what your organization will allow and not allow. I think is for us, that's where that begins. So
great. Excellent. I love the engagement in the chat. So keep those questions going. We'll get to those in just a moment. I'd like to talk about what's next. What are the must-have registration tech features to eliminate friction? Cole's nodding her head. Go ahead.
Yeah, I think so. Integrating with the CRM is critical, right? Back to the earlier point where I was talking about an event should never be standalone, right? It's another marketing tactic that we're doing amongst many other things. And it's really important to understand that, Julia attended this event, right? And that was part of this campaign. And, she registered but didn't attend, or whatever the case may be. If other folks in the organization are trying to understand that customer or that account. So I think the other part of that, by integrating with your CRM, you're able to actually move in the direction of having much better user experience, because you can get to things where the CRM data can pre-populate. It recognizes Julia's been here before. Julia's a repeat attendee. So Julia doesn't need to fill out all this information. She might just need to see if it's correct or not, right? The other thing is, I know we love to collect demos and we love to collect information, but what do you really need to have, must have versus want to have or like to have? And giving the user an opportunity to kind of select through how much they're willing or wanting to share so that the process isn't onerous, right? But really, when you can enter it with the CRM, then you get to go to single click registration or repeat user registration. I love that as a consumer, right? Somebody recognizes me. I've been there, done that. I can click in one click and say, I want to go to this new event. I love that, right? So that's kind of the end goal. Of course, it's much more difficult when you're doing very complex events that are multi-day CME events, right? And things like that. But I do think we have opportunities to move to single click and repeat user registration, especially if we can integrate with the CRM.
Great point. Thanks for that input. That does go into my next question, which is about balancing seamless registration with HIPAA, with CME, and global compliance. Susan.
So all of the information that we collect in our registration system, by standard, anything that comes out of from our healthcare network has to abide by HIPAA and all of that. We would obviously never collect any medical data or anything like that. Our systems are completely separate, and we actually do not have access to like Epic or anything like that when it comes to somebody's personal medical information. So we would never request that of anyone. And again, just by the standards of which we operate, our systems are extremely secure, and that information would never be allowed to be shared with anybody else.
Great.
Hopefully that answers your question.
Sure. And then I have another AI question, Kunwal. How do you see it reshaping the healthcare events in the coming years?
So role-based smarter registration, right? Pre-filled forms, AI-assisted credential validation. One of the other aspect would be one-click verification, check-in process. Make it user-friendly, automated, have certain, I guess it's more of the AI chatbot. So if someone is not experienced, there's 24 hours that you can guide the user on registration. Role-based smart registration should also include if I'm a physician, I should be able to see all physician-related. My profile should have a cardiology-related seminars, like a little bit more matched to what my interest is. And it should invite me into those seminars. Similarly, if I'm a patient, same thing. So if I have certain related preferences that I would like to attend and some of the events, that should match my profile. So looking at it that way. But I think the security of it is a lot more important for me as well. So making sure that the platform is secure, it's compliant, and then also it's integrated. So integrated tool, I know Nicole talked about a lot of CRM and EHR integration. That is the key.
Not right? EHR. CRM and the event platform integration.
Okay. Awesome. Yeah. So I would go beyond.
You would not want to integrate your EHR with the CRM. Like, let's be clear. Please do not. Yeah, absolutely not. Those are two separate, like, Chinese firewall.
Right. So for in healthcare, if you are hosting an event which is healthcare related and your guests are the patients, so what are you doing is you're going from one platform to the other platform to the other platform, and that's administrative hours. Trying to reduce that to have that integration done. So when you are registering a patient, it seamlessly flows in the demographic information. I'm not talking about the clinical information. And then from there, your predictable data, right? So if you have tool plays that are predicting the data of how patients sounds like or what patient is complaining about, that is something that will help you. I know Dr. Sanjay Gupta once, I've attended his seminar once, and he said AI is an angel on your shoulder, something that we don't see and we don't hear because we're too much involved in what's going on right now. The AI hears it, right? And then that is the prediction of the data that should be calculated, presented, and see what we are missing. That in the conversation with one-on-one with the patient, that AI has caught it and said, I could call a registrar and say, hey, I'm down today, but I do need to see a primary care. The down part is missed, but the primary care appointment has been made. So that is the beauty of AI. And that is what we believe in healthcare at SN Healthcare. And we are constantly trying to implement and develop tools to provide best care.
I love that perspective.
If I could just say too, for AI, we are actually just partnered with a vendor to utilize AI to cleanse our CRM system. So the AI system is looking at all of the constituents that we have in our system to verify date of birth, address, verifying duplicate records. It's going to be looking at get information around giving history. How do they like to be communicated with? What time of the year do they typically like to make their gifts? So that way we can utilize that data to kind of instruct what our strategy is going forward. So you could go as far as to say, okay, we have this group of donors who like to give in the fall. So we're going to market to them in the fall. We're not going to send them 3 other communications because they don't reply to those communications. So it saves both on time, money, and annoyance to the donor who keeps getting communications that they just throw in the trash, or emails they just start up, or, God forbid, we don't want them to unsubscribe to something because they keep getting communications that they know that they're not going to reply to. So AI can really be useful in that way as well, which is kind of like the precursor to, events and engagement in that way.
I think we could have a whole nother webinar on AI. It sounds like, right? Mm-hmm. It does. Great input. Thank you so much for all of your insights, ladies. I want to shift the conversation just a little bit for a little fun. If you weren't in the healthcare events industry, what would you be doing? I'll start with you, Nicole.
Oh my goodness. I probably would probably be more engaged with doing things in the community. I've got 3 kids. I don't have a lot of time to do all the things that I see in all the newsletters and all the communications I get from the schools and the different groups and parts that we're a part of. So I probably would be spending time doing that if I wasn't doing marketing in the healthcare space. I don't know. I'm still feeling really great vibes when Susan's like, we're cleansing our CRM. Like, oh my gosh. Gosh, 10 years ago, right? It was like the land of like pulling spreadsheets and reconciling contacts and accounts. And you would spend a whole year doing a CRM, pipeline hygiene, data cleanse hygiene projects, all these things. And you're like, oh, they were dreadful, right? And now look where we are, right? Which now will enable us to use CRM data to, market to folks and invite people. But I feel so good when you're like, oh, we're cleansing our CRM.
Yeah. I guess you have chosen the right industry for you. For sure. I love that. What would you do if you did another role?
So I've been in many roles before. This is my last stop. So my background is in legal. And then I've made a shift into healthcare. I've seen how my parents had struggled communicating with the providers, or just communicating and following up with the physicians on their health. And that piece got to my head, and I said, what can I do to make a difference in a community? So I've changed my career. I've changed my career to healthcare IT to make sure that I invent tools that assist and help providers on managing human health better. So the logic behind what you're due for, annual wellness visit, how can we improve your health by just hearing you out and listening to you and making sure some of the automations are done to increase efficiencies for healthcare workers and also reduces the error that impacts human health. So I think I am in a great spot. I wouldn't change it ever for anything, and I would remain here forever.
Beautiful answer. Again, you're definitely aligned with what you're meant to be doing. Susan, if you had to choose another industry, what would it be?
It would be probably the same industry, but a different position. So prior to moving into this role, I was in planned giving. So it's working with older donors and their estate planning, setting up trusts and things like that, so that they can give back to an institution that resonates with them and that is special to them. So really helping people kind of create what their legacy is going to be. So
excellent. And this one's kind of fun. If you could host a medical conference anywhere in the world, where would it be?
Oh my gosh.
Let's go to Paris.
Yeah, are we going to be
somewhere in Europe?
How many attendees we get? Because we could go to Lake Como and we're going to get 3 people. It's just too expensive and people can't take the time off, right? But if there's no KPIs, right? I love to think of having events that are more kind of thought-provoking events, or events where you're really trying to cultivate a community or incite, kind of community-driven action or mission-driven action. I love it when they're next to water, because I feel like water sort of instills an opportunity for deep thinking and an opportunity to really be away from the office, right? And the hustle and bustle. But yeah, if we had some KPIs on this, I'd be like, we're not going to go to Lake Como, right? It's too expensive and we're not going to have good turnout, but that would be cool.
I'm already there in my mind, though. That's the best destination you can choose. Susan, how about you? Anywhere in the world, where would you want to host your next event?
I would actually probably say Big Sur. We took our kids there just a couple weeks ago in California, and it's definitely a very magical place, with all the redwoods and all the cliffs and bluffs, and the ocean is right there. So it's a very beautiful, peaceful place to be. So I think that would be an awesome place to have a conference.
The Q&A is next, but I would like to know where Conwell would like to host her event.
So I know I love the idea of ocean and vacation time, but I think I would take it as a different perspective of maybe partnering with UN, maybe finding out where the actual needs are and travel with them and have awareness of healthcare, awareness of IT technology tools that can improve areas and regions of the country and other countries, and just go around and help the world.
I loved all of those answers, and I would love to join you at any of those events. They sound fantastic.
Who doesn't want international travel here? Come on.
I do want to get to these questions that have been coming in. Keep them coming. If you have any additional questions, we'd love to answer those. Let's see. I've got one here from Ryan, and he's got a question. How can technology help simplify complex healthcare event registrations?
So I will say the role-based options that are available now. So it's, preloading your invitation list, with a column that simply says, what role that person has. So whether it's they're the physician, charity ball that I'm working on is a perfect example. We have internal staff that are coming. We also have outside donors. We have sponsors. So that could be 3 different role-based participants for the event. And, based on what they're participating in, what information they need to know or have access to, the registration system is smart enough to know that once that's loaded into the system, and then they can register for whatever options are pertaining to them based on their role.
Excellent. Shania's got a question. Are there any case studies where smarter registration boosted event attendance?
Yeah, I think from not necessarily like attendance like day of, but I'm guessing, there's countless examples of how smarter registration aids in registration, right? I think that, the less friction you have from a user experience standpoint, like the quicker and easier it is, you will naturally get better uptake on it, right? So, I don't have anything offhand, but everything we do, right, should be thinking about the user experience, the customer journey, and as less friction as possible. I like Susan's example of like the role-based piece and pre-populating stuff. But, from the registration standpoint on the marketing side, absolutely. The less friction, the better results you'll get.
Great. Another question from Ryan. Talking about security, I was told that HIPAA compliance is crucial in healthcare events. What are the biggest challenges in maintaining data security during the registration process, and how can we event organizers overcome them?
I would say that you have to make sure that whatever company you are partnering with that manages your registration, that needs to be strongly vetted by your IT department. I wouldn't just go online and find a free event registration system to use or something like that. You need to really engage your IT department and make sure they are on board with whatever system you are utilizing, to make sure all of those precautions are put in place before anyone registers for anything.
Mm-hmm. Yeah, I agree with that as well. The onboarding of a vendor really depends on how you have tested out the security assessment. You have done security assessment, you have done your compliance and legal contract process with the vendor, and really making sure that you're bubbling up, not just by vendor, but internally as well. So you need to have some policy place for access management, right? And then also the accessibility of the application and the tools that you're going to utilize. Have MFA developed, right? So I know a lot of company loves the single sign-on because it's just great, but then you got to have MFA as well, and making sure that the registration is secure, because it's not only healthcare related patient data, it's also your data. And making sure you have strict policy of zero tolerance with sharing your password, having your sticky note laying around with my password. Those things needs to be controlled internally, and I know that we have a very great and very strong security posture internally, externally, and the way we manage our vendors, it's the same way. So we expect the same thing from our vendors. So anything that is developed internally, we ask our vendor to adapt to it as well. Cloudflare security implementation, or at the MFA, or things that you need to make sure that is all data, including financial, patient, and employee data. It's secure.
Excellent. Zach's asking, how do you think healthcare event organizers can prevent technical glitches during registration, such as system crashes or payment gateway failures?
I would say from my standpoint, our organization has very strong firewalls. We don't utilize Google Docs, nothing like that. We have access to none of that. So something that happened last year for one of our events was people from the outside could register. But if you were trying to utilize your St. Luke's laptop, you couldn't register for the event because it was blocking the registration. We were blocking ourselves from registering. So just, we quickly fixed that by calling IT. So we just make sure that anytime we're sending out a large communication where there's a large number of recipients, or, we're going to be launching a registration system, we just make sure that IT is aware of it so that they know to whitelist certain things so that way there aren't any glitches. So just having constant communication with your IT department so you are aware of what their rules and regulations are and what will and won't work, I think is really important. And then when something funky happens, you have the via dial to call them and ask them for help.
So Susan, that goes back to my statement earlier, right? The AI chatbot. So that should be implemented within the vendor tool to make sure that they're also available when you are, or your IT, right? So we worked on a lot of internal development and some of the stuff that, the tools that you use internally to communicate. Instead of creating a ticket, there is a chatbot that IT can pop up and say, hey, follow these instructions. If you can, let me create a ticket for you. So you don't have to create a ticket. Or just let me send somebody over, right? So these automation, not delaying the process for the event and having a sad face during the event instead of being happy. So I think those tools should be developed and should be utilized.
Great. Julie has a question. What are your thoughts on the online registration form, including mandatory questions to collect data? For example, attendee specialty, subspecialty, how they've heard about the meeting, etc.
Think what must you have? What would you like to have? And then thinking about where in the journey can you collect that information? Do you have to collect that information at the onset of the initial registration? Or can it be a follow-up? Or is it something they do on site or in the event, right? What are the opportunities for you to collect that information along the way? Back to the same thing with broken links or things that don't work, or firewall, doesn't allow folks to get to the registration page. Always test it. Always. I don't send an email marketing communication out without other people testing and looking and making sure the links work, right? So now there's a lot of tools to Kenwell's point, a lot of platforms will indicate to you that you have a link that's not, make sure that it works. It looks like it may not work, right? But always test, right? Always test especially before you go live with a major event registration right? And launch. But always test your stuff. That's the best way to prohibit things from getting out there that don't work, right?
Great. And then Zach is asking, does using intuitive, straightforward registration forms that only request essential information not considered as a personalized registration?
So doesn't that tie it up to the role-based registration? I think that needs to happen. So if your role is physician, the form should be catered to the physician, collecting the data that is required from them as to the sponsor or the patient, right? So that should be role-based generated. And earlier question was the required items, right? Aren't we all as good as the data we get, right? So if we're collecting that, we can improve the profile of the attendee and start sending them campaigns related to their profile, what their interests are, and what is the next event that Nicole is going to put out, and she would want only certain type of individuals in that room, right? So that is the data, right? And so I think the required field should be very thought about and put together, and then the logic behind it. Why do you need this requirement? What can you get out of this requirement? How does it improve your workflow, efficiency, future events, future prediction of the data, managing health? When you're creating those forms, think about those things and see if there's a requirement and then sub-requirement, and what can your IT do to place a logic in the back end for these forms.
Great. Ryan's got our next question. What are the key metrics for measuring the ROI of implementing a smarter registration system in a healthcare event, especially in terms of attendee satisfaction and knowledge retention?
So I would say in order to understand someone's satisfaction, obviously you're going to have to survey them at the end of post-event. There are different systems out there where you can, based on the score, you're going to have to do this for multiple events, right, to kind of see where your score lands. But they have different grading scales to say okay, if your attendees scored if it's a 1 to 5, if the average was a 4, then they're more likely to attend a future event. There are different things like that as far as surveys that can be utilized. Another way that we judge ROI is, takes a little bit longer, but it's making sure that we get the registration information of who attended back into the CRM, obviously, because if you don't do that, you don't know anything about ROI. So that's the first key for really any of this. And then really looking at their giving patterns, their engagement patterns after post-event. Again, that's not going to be something that happens, the next day where you can say, oh yeah, I got this huge bump because this person attended, right? That's going to take a little bit of time and looking at the patterns of how they engage with you in the future and working with gift officers and things like that. But for really any of this, to be judging ROI on anything, it's really important to get all of that information back into your CRM system to understand who attended, who didn't, and why they may not have attended. They may have just been busy,
And then Ryan had a second question to that. Beyond basic demographic information, what are the most valuable data points to collect during registration to understand attendee learning styles and preferences?
That really depends on the event, right? So
Yeah,
if it's physician-driven, if it's provider learning series that has CME attached to it, so you're collecting different data, right? The specialty, the physician's information, and all the other stuff. If it's patient related, then you really need to know what are some of the issues or what are some of the interests patient has, right? So maybe like that driving piece of your next event. And I guess that's from technology point of view or healthcare point of view, that's what I think. Nicole, do you have any?
Yeah, my first answer was going to be, well, it depends on the event, right? And the audience, 1,000%, right? And do you need to know that, or is it nice to know, or is it for future marketing and communication opportunities? Then it's kind of one of those optional things of like, what would you like to hear about in the future? Online, that kind of thing. There's probably other ways to spin it, but it totally depends on what the event is and who it is that, you're asking about. Yeah, it's hard to generalize.
I would just say that's not something that I would ask as someone's registering for your event, because if you're like, my event's at night, and they're like, well, I learn best in the morning. Okay, well, we're not changing our event for you. Right. So I think those are questions that have to be asked in a post-event survey, or maybe you, depending on what the purpose of the event is and things like that, maybe you survey your target audience before you start making plans about logistics and things like that. That's not something that should be done during the registration. I don't
That's
think.
great feedback. Yeah.
And that goes back to the very first thing we talked about of like physicians, especially if they're in clinic, are very busy, right? And you can't just have something at 2 p.m. in the afternoon on a Wednesday and be like, why aren't people showing up, right? Like, because they're in clinic seeing patients, right? So kind of circling back all the way to where we started of positioning and being thoughtful about when and where and how you do your event as part of your larger strategy.
Excellent. Thank you. Hassan has another one here. How has AI shaping the future of event registration in healthcare, and what smart technologies should we be watching for in 2025?
I'd love to see, like we do on from a lead perspective, I'm always thinking about, okay, what percent to target am I in terms of my leads for the month or the quarter, or for, kind of qualified leads? Like, what if you could have more of like the predictive turnout, analytics for events, right? Understanding kind of past registration behaviors and times and kind of period 2 of the event that people start to register, when you usually see that hockey stick. If it's a short-term smaller event versus, bigger events, it's usually a bit more forward. But what if you could start to have some predictive turnout analytics of not only registration, but actually who then will attend? And that would be based on the information that you have on prior, behaviors of your data, right, that you have. But I think that kind of stuff is very, very, it's probably here, right? It's just you have to have enough data and good data to be able to do that kind of thing. But, that time back to kind of what your metrics and KPIs are would be great, because then you could say, well, we're going to do these 8 events and we expect to get this from it, right? And then you kind of would drive your marketing strategy and plans against that as well. So I think that's kind of on the horizon, if not already here.
Great. And then final question from Shania for Nicole. With the rise of hybrid and virtual healthcare events, how can organizers optimize the registration experience across different formats to maximize engagement and participation? Well,
it's really funny. Now we're starting to see, we went from the, COVID period that I'm so tired of hearing about, but like COVID period of where everything was virtual. we ended this hybrid period where it was very popular, and it was a lot of struggle, right? I think both on our end, right, as organizers and promoters, and then also like on the attendee end. And people got kind of lazy with events. You kind of saw events being put together and you're like, what's going on? I mean, I just was at ACHE this week here in Houston with 8,000 healthcare executives attend in person. And so I felt like this week I really did think through, gosh, you have 8,000 healthcare executives here in Houston in person for several days, right? And so we've really kind of, I think, there was a massive, I'm like, have we turned the corner where we're now saying, well, this is an in-person event. Maybe there'll be a hybrid option later. Maybe we'll, have a shorter adjunct session, or maybe we don't offer hybrid for this particular thing at all. And you start to bifurcate, how you distribute your content, how you distribute really your, who gets invited to what, right? And so I'm seeing a shift over the last 5-6 years. And this week really kind of brought it home where I was like, gosh, like everyone's in person for many days and these are busy people, right? So I don't know. So I think that that's ever moving, but it goes back to know your audience, right? Right time, right message, and really think through your positioning.
Fantastic. This has been such a wonderful discussion. Ladies, have really enjoyed it. Thank you for all of your insights. Before we close, I'd just like to ask for a key takeaway or a final insight. Susan, would you like to go first?
Yeah, I think from my perspective, it's really important that you kind of just, for successful events, you really build a foundation of good data, a good efficient registration system, and making sure you have clear expectations and policies around how you're going to utilize that information, and just being upfront with everyone that's on your team from different departments to make sure they know what their role is as well, to make sure, all of the information you're collecting from these events really gets utilized and gets back into the system.
Great. Kenwell, how about you? Any final insights or takeaways?
Yeah, sure. From healthcare smarter registration, automate role-based registration, integrate platforms that is being utilized with your registration application to eliminate any errors, to enhance any efficiencies that your staff members have been facing, and then also to boost your ROI and analytics. And use that data to do more events and manage human health better. So predictable data, right? So analytics comes into that play. So I think that should be the next step for any organization who's hosting the healthcare events.
Excellent. Nicole, final thoughts?
I love it. Well, I've learned so much from my fellow panelists here. They're awesome. I think back to kind of an event is never a standalone tactic. It's never a standalone thing, right? And whether it's the background of how, Susan and Kenwell have described very much how you've got to integrate with many departments and other systems, et cetera, but also from the marketing side, an event should tie into a much bigger marketing strategy, including your brand strategy as well. So it's really important to not think of event registration or event as a standalone thing, right? It's part of a much bigger strategy and plan, so you can better serve your customers, whether they're patients or whether they're physicians or consumers. So, but thank you for having us, Julia. It's been so lovely to have the conversation. What a great break from the day. So
thank you for being here. It was fantastic, ladies. Really, really enjoyed it. Thank you for your time. Thank you all for your wonderful questions and participation in the event today. If you'd like to be part of more exciting and thought-leading webinars, make sure you're following Eventcombo on LinkedIn and subscribe to their YouTube channel. Thank you again so much for joining us today. Have a great rest of your day, everyone. Bye-bye.
Bye-bye. Thanks.
Thank you.
Bye-bye.